Professional standards and guidelines with ultrasound use. Course objectives, the students will be able to verbalize the importance of professional standards and guidelines regarding OB/GYN ultrasound implementation. They'll be able to verbalize the different organizations, particularly the American Institute of Ultrasound in Medicine, AIUM, and what it has to do with national local scope of practices for point-of-care ultrasound. Students will be able to verbalize the more common recommendations within OB/GYN services from ACOG and the American College of Nurse Midwives around ultrasound point-of-care testing. This topic is really important because professional standards and guidelines for OB/GYN practitioners to implement those point-of-care ultrasounds are really important for several reasons. We need to make sure we have the highest quality standards possible. We need to make sure we're getting accurate diagnoses, we're doing best practice management, we're utilizing the point-of-care testing when it's applicable, when it's not applicable. We're able to utilize the online in-person continuing development resources that are available. We're always improving quality with patient satisfaction, with improved outcomes, cost, being resilient with the resources we have, collaborating with our care team, utilizing the specialist and the people outside of your scope of practice when appropriate. So as an introduction, it's good to know that ultrasound practices in the US have really been growing and expanding of the bedside implementation. It used to be sending them to a sonographer or to the radiology department, and it's getting more and more with urgent cares, EMS, rural communities, triage, clinics to be able to use ultrasound services to help determine the care standards and where to go next with what is needed for the patients. The American Institute of Ultrasound in Medicine provides those standards and guidelines based on the accreditation of ultrasound practices. It puts into place minimum trainings, experience, continuing education requirements so that if someone wants to add ultrasound services to their practice, they have a certain benchmark they need to meet. You need to have certain requirements for safety, competencies, checking on the machine, certain types of machines for certain specialties. When is it appropriate? What is the informed consent? How is the management being determined based on those point of care ultrasound accurate results? You want to focus on these guidelines when you are implementing ultrasound services within your practice. Even if it's already established, you can always improve that quality of your ultrasound. What are your policies? When's the last time they were reviewed? When is the last time there's been a benchmark of continuing education, a review, a more seasoned sonographer joining and checking over everyone to make sure that that quality is a high benchmark? The Society of Radiographers and British Medical Ultrasound Sonography also has some great resources that you can tap into to support the implementation of ultrasound practice. You want to look at the updated guidelines for ultrasound practice. Europe has many great ones just as much as in the US, and it's really important to have policies, protocols, how often you're checking out the machine, who's in charge of what, how are you reviewing the reports, how is the documentation being done, how is it being billed? Are there codes you're missing for revenue? Is there certain things on the report? Is there certain calibers? Is there certain indicators that need to be met to justify implementing that ultrasound? The American Institute of Ultrasound in Medicine has specific guidelines that you guys can easily reference attached to these courses, and they put into parameters of what is the scope, different specialties, different healthcare professionals, how to implement it, when to implement it, where is that legal standard of care that you're going to be held to. You want to make sure that your organization has a good task force team that standardizes the curriculum, the competencies, the training, the residency programs, the new graduates on the teams, the new hires, the annual reviews. You have to have a minimum amount that it's being utilized. You're reviewing the charts, reviewing the outcomes based on the findings of those ultrasounds. Training guidelines for professionals has really to do with getting good understanding of not just knowing how to hold the machine, how to determine when to implement it, and management based on the result finding, but also the image interpretation, the comfort of the patient, the education, the documentation, the maintenance, how to set the probe, how to clean it up, how to sterilize the transvaginal probe between the patients, how is it being documented. Those are really detailed day-to-day operations that are part of making your practice average to really the highest quality care possible when we're talking about ultrasound point of care. There's also many, many organizations out there that have joint task force to utilize when you're implementing and starting your practice. And so I strongly encourage everybody to look, are you going above and beyond the parameters, the standards? Are you below the benchmarks? Is your team lacking? Is there some deficiencies of quality metrics not being met, whether you're implementing it or you've had ultrasound services with your practice? Talking to even the local ultrasound companies, the representatives, the sales reps, they have a lot of tools and resources and guidance to help you with implementing it because they've helped many other practices do it. Scope of work is really important for understanding the difference between point of care testing versus the physician interpretation scope of practice, diagnostic testing versus point of care testing. It's really, really important to understand the difference because I do hear this across the country. Point of care just means you're grabbing the machine and you're doing it at the bedside, and that's not accurate. There's certain things, particularly an anatomy scan, 20-week anatomy scan, has to be a physician, a radiologist, or a sonographer, or an advanced clinician, but it's also read by a physician. Point of care has to do with more determining the management. So an IUD placement, confirmation of pregnancy, viability, dating, biophysical profile, growth, placenta location, gross anomalies, abnormal vaginal bleeding, and want to look at the endometrial lining, infertility treatment. There's specific guidelines that it's in conjunction with management versus a specific diagnostic testing like a fetal anatomy. You want to be able to understand, and also there's national guidelines, but your own organizations, your own hospitals, your own clinics can put in some things that are more lenient. Maybe there's additional training that your team gets, or it's a little bit more conservative than what the guidelines are. So you really ultimately have to look at your own policies, protocols, scope of practice within your organization, within your state, your national certification, the international, national benchmarks that are being set. Because if there is ever a question of practicing medicine without a license, practicing outside of your scope, you need to have benchmarks that you can go to defend. This was the policy. This was my certification. These are the trainings I got. I got the ARDMS certification to do this XYZ. You need to be able to clearly show all the different point of care testings that are being offered and rendered at your organization within the scope of practice for each healthcare practitioner, because a physician assistant, a nurse practitioner, a physician, a nurse, a sonographer, and a midwife are all going to have different scopes and standards and expectations and competencies and tools and resources of when they're implementing point of care testing versus a diagnostic test. So the whole purpose is rapid screening, decision making, especially if you have those 9-10 week gestation ladies and you can't get a heartbeat with a Doppler. How much time and stress you can save by just grabbing the ultrasound machine down the hallway, getting a nice strong heartbeat. She's having some vaginal bleeding. You can look and see if there's a heartbeat, if the baby is measuring appropriately. You can get some HCG levels. A lot of ultrasound departments are just overwhelmed, and it takes days and days to get a patient in. You got to send them to triage or urgent care or ER to be able to be accelerated in that ultrasound scheduling system. Versus you can grab the machine and you can confirm baby is head down, she's in early labor, especially in OB triage and interpartum management. Having point of care ultrasounds is really, really helpful. You have a low-lying placenta, there's some abnormal bleeding, there's a history. You can make decisions very quickly in these urgent care settings when there's more concerning symptoms arise. I have to stress, you have to know your equipment well. You have to know how to use the machine. I think too many times people are just teaching themselves versus getting a formal training, whether it's in school, whether it's on the job. There's a lot of just learning as you go and a lot of mistakes being made that they don't even realize they're making. As being a practitioner myself, we would see it time and time again. The average advanced clinician isn't getting the quality of training that they deserve, whether it's from a sonographer, from a physician, from a formal training. It's a lot of just life experience and grabbing the machine and playing around. And I think we can accelerate the quality quality improvements and the safety outcomes by having formal trainings in place. Knowing how to collaborate with people on your healthcare team. When do you grab the physician down the hallway? When do you call? When do you get perinatal team involved? When do you get, is it immediately? Is it need a follow-up in a month? Is it something that you need to get some additional resources and information, a formal ultrasound on top of the point of care ultrasound before you collaborate with a team? Those are the decisions the clinician has. So you really want to look at just the physician scope compared to an advanced practice clinician. They are different. The trainings are different, the certifications, the regulations. And so point of care testing is more for advanced practice clinicians to be really focusing on. Physicians can do point of care testing, but they also can do diagnostic testing. So you really want to do that same thing. There's many physicians, family practice physicians will collaborate with specialists. Obstetricians will collaborate with high-risk MFM. You always are going to have multidisciplinary approaches to care based on the results of those point-of-care ultrasounds. So you really want to make sure that your whole team, I can't stress this enough, what are the hospital medical regulations for privileges, for working the job? What's the medical regulations in that state? What is the scope of practice? Is there a position with your services, particularly certified professional midwives, licensed midwives? A lot of states don't have anything written. Even their own scope of practice is very vague about ultrasound use. And so you have to be very careful and clear if you're doing something that isn't referenced in your national and local guidelines. Your policies, your training, your quality measures better be top notch, because that's what's going to be your defense if there's ever a question of a poor outcome, a near miss, a patient complaint, a regulatory compliance investigation. You've got to really make sure you have your ducks in. So as a summary, professional standards and guidelines are extremely important for implementing and maintaining high quality care, especially with point of care ultrasound services. It is getting utilized more and more each day, and we need to make sure that the healthcare professionals that are actually implementing it have a benchmark of policies, protocols, education, understanding of the machine that I truly believe has been lacking for many years. We're implementing a lot more technology into our service lines that we don't completely understand. And so that's the whole point of these trainings, to really get you to understand the machine, understand how to implement it appropriately, how to collaborate, how to document, how to make sure that what you're interpreting on the images is actually the most accurate thing you're seeing.